Okay, so good afternoon to everyone in the US, and good morning to anyone who's joining us from here in Australia. My name is Katie Haruno, and I'm here with Fiona Haig. And we are going to be talking today about the health impact assessment we conducted on the Trans-Pacific Partnership here in Australia. And we just wanted to start by thanking Krisha Crawling and Joshua Yang, who are part of the APHA Health and Trade Forum, for connecting with us and helping to put this together. We are really excited to share our results and talk to the US audience.
My name is Fiona Haig. I'm a research fellow at the Centre for Health Equity Training Research and Evaluation, which is at the University of New South Wales in Australia. Some of you might be able to detect that I'm not an Australian. I'm actually from New Zealand. And I've been working in the field of HIA for, I think, about 12 years now. I started off working in HIA in Germany, and then in England at a place called Impact at the University of Liverpool. And then I've been working with Chetra for the last, coming up 5 years now. And I'll just let Katie introduce herself. Where are you going?
I'm Katie Hirono. You should be able to tell from my accent as well that I'm also not Australian. I'm actually from the US, where prior to coming to Chetra, I was working at the Health Impact Project, which is part of the it's a collaboration between the Peace Charitable Trusts and the Robert Wood Johnson Foundation. I was helping to increase the use of HIA in the US. And then moved over to Australia about 2 years ago and have been working with Chetra on the HIA work that they're doing here. So it was a great opportunity to come here. And actually one of the first projects I did here was working on the HIA of the TPP that we're going to be talking about today.
So the way this presentation is going to work is we're kind of going to tag team it. So I'm going to start off talking a little bit about the process of the health impact assessment. And then Katie's going to tell us about the findings, and then we'll sort of finish off talking together about some reflections on the process. So I'll start off now. Just getting our slides going. Okay, so the Trans-Pacific Partnership Agreement is a trade agreement that's being negotiated between about 12 different Pacific Rim countries. It's kind of interesting because within these countries, there's quite different stages of development. So you have, for example, Australia, which has a GDP of about $67,000 compared to, say, Vietnam, which has one of about 2,000. But they're all going to have the same sort of conditions if they agree to join this trade agreement. So negotiations began in about 2010. They've had 20 negotiating rounds, plus other sort of meetings that have been going on. It's in its final stages, but having said that, we've been hearing that it's in its final stages since we began this process sort of in late 2013. But it does sound like it is actually beginning to get towards the end. The agenda of the trade agreement is sort of primarily set by the US. It's a US-driven trade agreement. And it's going to be a big free trade zone in the Asia Pacific and beyond. Some interesting things about the TPP. There's a few things that are interesting about it, actually. First of all, these sort of modern day trade agreements are different than traditional trade agreements that used to focus on reading all the messages now, everyone's happy, that focused on basically setting up sort of free trade zones, so it was about tariffs, opening up markets, whereas these modern day trade agreements focus on a lot more things. So, for example, they have sections that are looking at intellectual property, requirements about dispute resolution systems, manufacturing standards. So they actually cover really broad areas and a lot more than just sort of traditional trade. And the other things that are interesting about them and troubling about them is they're negotiated in secret, so it's very difficult to find out exactly what's going on. And there's a lot of industry input into developing the trade agreement. You have industry partners even helping draft parts of the text, whereas there's a limited opportunity for public health input and citizen input. So against this background, we decided to carry out this health impact assessment. So it started off originally, that actually just a colleague of mine, Patrick Harris, met up with another Australian colleague called Deb Gleeson. Patrick knows a lot about HIA, Deb knows a lot about trade and health, and they got talking at a conference and sort of came up with the idea, wouldn't it be good to maybe do an HIA on this? And Patrick came back to the office and we talked about it, and we thought, oh, maybe this is something we could do. And so we got together and had a meeting and invited some people along. And so it started off as quite a small process that sort of grew bigger with time. And we decided that it would be useful to do a health impact assessment on the TPP in order to inform advocacy efforts around the TPP. Now, for those of you who aren't familiar with HIA, basically it's a process for identifying the future consequences of a proposed action. So, for example, looking at something like a trade agreement and trying to understand how that could impact on health in the future. So you're trying to understand how something will affect health and well-being, who it's going to affect, are there going to be winners and losers, but also what can we do about it. So at the end point of an HIA, you develop recommendations about how you can maximise potential positive health impacts and minimise potential negatives. So it's both a technical process, so you're gathering evidence, you're assessing evidence, you're coming up with a report, but it's also tactical in terms of it provides a process that you can use for engaging and influencing policy and stakeholders. So in terms of the structure of the HIA, we had a small working group which started off with Patrick, myself and Deb, and then we managed to bring along Katie as our research officer, and Katie ended up doing the bulk of the work on this HIA. And at a later point, we had another person, Anne-Marie Thau, who joined the small working group. We talked to the Public Health Association of Australia, and they agreed to provide sort of overall kind of, in some ways, ownership of the HIA process. And so they helped us in terms of running a workshop, sort of setting up a workshop for us, and doing a lot of the sort of working with advocacy groups. And then in addition to that, we had a technical advisory group who was full of people who knew about trade and health impact assessment and equity. And then we also set up an advocacy advisory group, which I've got a slide on the next page, which shows the logos of not quite all of the groups who are involved in that group. I think there are a few more than that. And so this advocacy group, this was a new thing in terms of us doing HIAs, and it was made up of a mix of public health advocacy groups, but also consumer advocacy groups. So, for example, we had Choice, which in Australia is the main sort of consumer advocacy group. They publish like a monthly magazine where they do things like reviewing washing machines, but they also do a lot of advocacy work around consumer rights. So we had quite a mix of stakeholders involved. Now, in terms of the HIA process, it followed the typical steps in some ways in terms of we had screening meetings to decide, that we're going to go ahead with the HIA. We scoped out the HIA in terms of we had a meeting with the advisory group where we planned what we're going to look at and talked to the advocacy groups. And we gathered evidence, assessed it, developed recommendations. What was slightly unusual about it is that we developed scenarios in order to assess. And the other, I'll just bring up all those. And the other thing that we did that was slightly different than a typical HIA process is very early on we also developed a policy brief. And that was because we were trying to fit this HIA around the TPP process. And that was back in sort of early 2014. We heard that it sounded like it was going to be finalised really soon. And we knew that our HIA wasn't going to be finished by then, but we wanted to get something out there already. So we did a sort of like an evidence brief that we released. And I'm going to talk a little bit more about the development of those scenarios a little bit later on. And so the whole process, it kicked off at the end of 2013, and originally we thought this was going to be, sort of like a 4 to 6 month type process, but it ended up taking sort of almost 18 months altogether, which probably isn't that surprising to those of you who are familiar with health impact assessments. And this kind of reflects what the TPP process looked like. So we had our HIA process, which in some ways, had sort of reasonably clear stages, and then we were trying to match that up with the TPP negotiating process that just seemed to be going backwards and forwards and was pretty hard to unpack. So as I mentioned before, one thing we did with this HIA was we developed scenarios to assess, because typically in an HIA, you have some kind of proposal, something that you can kind of get your head around and you can unpack, like, how is this going to impact on health? But here, since everything was negotiated in secret, we didn't actually have a proposal, we just had some leaked text. And then the other thing about the HIA, or about the TPP, is it only impacts on future policy. So when we were trying to understand how the TPP could impact on health policies, we had to try and develop ideas for what health policies were likely to be impacted on. So we developed policy scenarios based on the following criteria. So we wanted to identify policy scenarios that were either a current priority or likely to become a priority for advocacy groups. And that was because, this was an advocacy HIA, so we wanted to look at things that the advocacy groups were interested and could work with. And because we had limited time and resources, we also knew that we couldn't look at a really broad range of impacts. So we selected ones that there was a good evidence base for, so that we could come up with reasonably strong impact assessment findings and recommendations. And then we also looked at, sort of based on what we knew about the leaked text and from previous trade agreements, we needed to identify policies that were actually likely to be impacted on by the TPP. So the scenarios that we ended up identifying is looking at medicines at increased out-of-pocket costs for patients, tobacco, looking at marketing restrictions. In Australia, there's already a ban on, there's already plain packaging legislation, so we knew that wouldn't be affected by the TPP since it's already in place. So we were looking at future tobacco marketing restrictions that might be put in place. Alcohol, looking at regulation of warning labels and alcohol availability. And food, we were looking at regulation of food labelling, because that was an area that's, there's been a little bit of activity recently in Australia, and it seemed one that it was quite reasonable that there might be future regulation of food labelling. And so once we developed these scenarios, we developed them by, I should have said, Katie carried out interviews with people from our advocacy group and from our advisory group to help select these scenarios. And then we went and looked at the literature around them, and we sort of carried out a preliminary impact assessment, developed some pathways, how we thought the TPP could potentially impact on these policies and how that would in turn impact on health. And then what we did was we had an assessment workshop where we invited everyone in our two advisory groups and also other people along to look at everything that we had found and work with us with them. And so what we did was we had this workshop, and we had sort of three main areas that we looked at with the groups. So we presented them with summaries of the literature and our findings so far, and then we asked questions about do we think that the TPP will impact on this policy scenario? So in terms of what we were showing them, is it plausible? Do we have enough evidence? Have we missed anything? And then we wanted to look at what was the impact of those policy scenarios on health. So again, asking questions about, the preliminary pathway that we developed, was it plausible? Is this significant? Is this something we need to do something about? Do we have enough evidence? Are we missing anything? And also, who are the winners and losers? So asking those equity questions about, and are some of them more important than others? And then we also looked at recommendations. So recommendations for how we think the TPP should look if it goes ahead, but also recommendations on policy in terms of how the government should go about negotiating and dealing with the TPP. So now I'm going to hand over to Katie, who's going to talk to you about some of those findings.
Great. So this is our sort of pathway diagram for the looking specifically at the cost of medicines. And so what we had here is that we kind of looking at previous trade agreements and looking at leaked texts that had been available through things like WikiLeaks, we were able to see what some of the potential provisions were that were going to be in the TPP. And so this one we looked at specifically the intellectual property chapter, which has a lot to do with sort of how long intellectual property has to be granted to pharmaceutical development. So you might hear some of the debate right now that's around biologics, which is a form of medicine that is typically a little bit more expensive, a little bit harder to develop. And in Australia right now, the intellectual property on that is about 5 years. I'm sorry, the patent on that is 5 years, and in the U.S., I believe it's 12. So there's been some negotiation around trying to, maybe U.S. has agreed to 8, but then other countries are saying that it shouldn't be more than 5. The whole implication with this is that you can imagine that the longer that pharmaceutical companies have patent rights, the longer it takes for generics to enter the market. And so in Australia, the way that, which is quite different from the US in the way that medications are financed, is they go through the pharmaceutical benefit scheme, which basically helps to set the price and manages the pricing of medications for Australians. So, but looking at this, even though the PBS would be the primary entity that those increased costs would affect, we've seen that in the past, the PBS has sort of managed increasing costs by then increasing the out-of-pocket cost to patients. So what was likely to happen if these sort of patent extensions are included in the TPP is we would see an out-of-pocket increase for patients, which then has lots of health impacts, things like medical non-adherence, so patients not actually taking the prescriptions they're supposed to take. And then we've also seen things in the literature around patients prioritizing those health costs over other things, so paying for your medications rather than paying for your groceries or your heating bill. And so this, of course, leads to things like declining health status, increased hospitalizations, a higher use of emergency services. And we also looked at specifically how this could impact on particular vulnerable populations. So obviously people with low socioeconomic status are less able to compensate for those increased out-of-pocket expenses. And we've seen this is particularly important for people with chronic conditions, because those are people who are already taking lots of medications. They already have a lot of costs associated with that. So increasing those costs, even if minimally, can have a large impact on those populations. The next area, so then what we did is we actually sort of characterized what that impact would be. So we looked at what the overall impact was and said, that any provisions that were likely to increase the cost of medications or medicines in Australia would have an overall negative impact on health. So we didn't see anything good coming out of that, which in HIA, we want to look at both the positives and the negatives, and we just didn't find anything positive from that. So the next area that we looked at was around tobacco control, and what we looked at specifically was related to advertising restrictions that can occur both within federal policy, but then also in local, state, and territory advertising. So that could be things like whether or not you allow tobacco vending machines or the types of tobacco advertising that's allowed. So Australia is already very progressive in this area compared to the US. We have plain packaging here. There's lots of federal regulations about, where you can actually advertise tobacco. But in people that I interviewed, that this is an area where they're still trying to push things. They're still trying to increase those restrictions. So the types of provisions that could potentially affect that, or more specifically hinder that, were things like additional rules related to trademarks. Things like there's this chapter on technical barriers to trade, so whether or not a federal policy impedes a corporation's ability to trade would be regulated through the TPP. But something that came up of particular interest was the investor-state dispute settlement. And what this is it's a mechanism that allows foreign corporations the ability to sue governments if they believe that their rights according to a trade agreement have been infringed upon by domestic policy. And so actually, Australia has been in a very contentious legal debate with Philip Morris, who, through a trade agreement that Australia has with Hong Kong, which includes an ISDS annex in it, have been using that to sue the Australian government over its incorporation of plain packaging. So they've thus far been unsuccessful using other trade agreements. They've now are using the Hong Kong one to try to sue the government. But the important thing with this is that regardless of whether or not Australia wins that debate, it's still incredibly expensive to go through that litigation process. And in other countries where we've seen companies use that type of the ISDS mechanism in places like Uruguay, which can't afford to necessarily step up against these very wealthy corporations in the litigation process, what happens is that there has a chilling effect on policy. So if governments are afraid that something that they do might put them up to be contested through ISDS, they may not necessarily move forward with implementing that policy, even if there's other evidence that it would be beneficial for things like public health. So that's why, if anyone's heard about the ISDS, that's why it's a quite contentious mechanism. In Australia, the previous negotiators that were involved with this had said that they would not include ISDS under any circumstances. The new negotiators with the new government said that they would potentially agree to it given certain other negotiations. So this is something that the U.S. is pushing hard for, and lots of countries are sort of going either way with. So it'll be interesting to see whether or not it's included in the final agreement. But with relation to this particular pathway, what we saw is that all these types of provisions, when they restrict sort of any types of tobacco control mechanisms like advertising restrictions, it has a tendency to lead to either increased smoking in certain populations, or it maintains the current smoking prevalence, which of course has all of the well-known tobacco-related health outcomes: cancer, cardiovascular disease, declining health status, death. And we thought that this is particularly relevant in communities where there have been less successes in decreasing smoking prevalence. So particularly Aboriginal and Torres Strait Islander peoples, homeless populations, people with mental illness, people in prison, drug users. All of these have very high smoking prevalence rates. So any type of restrictions, any tobacco control restrictions that aren't able to move forward because of the TPP would have an increased effect on those populations. So again, overall, looking at the impact of this, we didn't find anything positive that could come from having changes to tobacco control regulation, and that overall would have a negative impact on health. So our next pathway was related to alcohol control, and we were specifically looking at potential incorporation of or federal regulation of pregnancy warning labels on alcohol containers, and then also the state and territory regulation of alcohol availability. So this would be things like how late different distributors are able to be open, sort of things related to alcohol density with, how many shops are able to be open in a certain area. And we found that, again, things related to the investor-state dispute settlement, and then also some chapters such as wine and spirits annex, cross-border services, all of these could have an effect on whether or not government is able to actually regulate the availability of alcohol, and whether or not they're able to require warning labels on alcohol containers. And, the reason why these types of policies in the public health world move forward is because there is a strong evidence base showing that when you do things like include warning labels, and when you restrict access to alcohol, it decreases consumption rates, and it particularly decreases substance abuse related to alcohol. And so when you don't include those types of alcohol control measures, or when those are restricted, we're likely to see things like continuing high rates of alcohol-related harm, behavioral impacts such as violence within the community, things like fetal alcohol spectrum disorders, social disruptions. So there's lots of evidence related to alcohol density and the incidence of things like violent assault. And again, this is particularly relevant for Aboriginal and Torres Strait Islander populations, which have a high incidence of alcohol-related harm, and then for adolescents, which are also sort of in a high-risk category related to alcohol consumption. And so overall, this would lead to sort of negative impacts on health. We didn't find anything positive about restricting alcohol control measures. And then lastly, related to food labeling. So what we were looking at here was about whether or not, or for future federal regulation of food labeling. So in Australia right now, there's not a federal requirement for front of package labeling. What it is, it's sort of a agreed upon industry standard where they have a certain type of labeling that's being used. It's the one that's being used right now is based on sort of a star rating. It's not according to best practice, which would include things like more graphic images, clear health messaging, and so which is sort of the area that a lot of advocates are pushing towards. So things like including a traffic light system, for example, with food labeling. So again, this had a lot to do with the TPP provisions around things like technical barriers to trade. So, whether or not requiring a food label could be considered a barrier to trade. Again, with the investor-state dispute settlement, potentially food companies could sue, saying that requirement of these labels could impede upon their right to trade. And so what we saw is that without being able to implement these types of innovative best practice, globally recognized policies, that you would continue to see the same levels of unhealthy consumption of unhealthy foods, which would continue the high rates of obesity and metabolic syndrome and obesity-related health outcomes in Australia. And again, you can see here that there's lots of populations that this is particularly relevant for. So groups with low levels of health literacy, populations that are culturally and linguistically diverse, that might have restrictions around language, and then other populations that have higher rates of obesity would sort of benefit from increased regulation of food labeling, and then in reverse would be more likely to be harmed if these types of regulations are not able to go forward because of these TPP provisions. So overall, that any provisions in the TPP that would hinder these policies would have a negative impact on health. Not really anything positive coming out of that. So you can see overall that we didn't really find anything positive related to the trade agreement, and that's based on the specific pathways that we were looking at. And so what we did is that based on our findings, we then came up with a set of recommendations. So there were recommendations that could specifically be given to the Department of Foreign Affairs and Trade, which is the government agency that conducts these negotiations. And those would be around specifically changes to the TPP provisions. Then we came up with recommendations that were for the Australian government around maybe modifying the negotiation process of the TPP. And then our advocates actually came up with some really good policy recommendations just related to this areas of medicine, alcohol, tobacco, and food to sort of continue to promote some of the findings that we had about best practices relating to these policies.
And also, I guess, to preempt the way the TPP only acts on future policies. There was this idea that, okay, maybe there's some policies you can quickly put in place now that could prevent some of those harms.
Right. Yeah. So here's just a couple of examples of some of the recommendations. So one of the key ones is that we said anywhere within the TPP text that public health concerns should override economic or trade concerns in areas where these may conflict. So that meant sort of having clear and strong public health exemptions to some of the regulations or some of the provisions within the TPP. And then we said that even if you included public health, that it shouldn't be defined to just sort of, like a lot of times trade agreements define public health around public health emergencies or sort of disease outbreaks. What we said is that public health should be defined really broadly. So not just, in relation to having access to HIV medication, but that it should be looking at the whole spectrum of areas of public health. So, things like obesity and tobacco control. And so that any provision that could potentially have an effect on those policies, there should be an exemption in those cases. And then relating to the negotiating process, we said that there should be more transparency related to how these trade agreements are made, that in particular, public health people should also be incorporated at the table when doing this types of trade agreement, rather than just having sort of corporations and private industry included. We also said that they should apply the precautionary principle, so meaning that in cases where they're not sure what the impact could be on health, that they should sort of be preemptive and taking sort of cautions to avoid any harm. So in the case where you don't know what the outcome is, it's sort of best to do nothing rather than to potentially have to create harm. And then we also said that, if the TPP is ratified, that they should do regular monitoring to sort of see what the health impacts are, and with a particular focus on seeing how those have an impact on certain groups related to equity. And that type of monitoring should be transparent, should be publicly reported, so that communities, populations, researchers can sort of see, whether or not these trade agreements are having the intended impact that they're supposed to have, or whether or not other negative things are occurring from them. And then lastly, regarding some of those policies, we said things like, capping what the co-payments are for patients through the PBS, and that the Australian government should do things like include more research towards some of these sort of innovative policies that we had looked at within the TPP. I'll mention all of the sort of more details about what we found, and all of the recommendations are included in this final report, which we released in March of this year. And so we had some really interesting outcomes come from releasing this report. So a lot of times what happens in an HIA, so you come up with this final report, you kind of send it off to the decision maker, maybe you have some good dialogue with them around, what your findings were, and that's sort of it. In our case, because we knew we didn't really have any formal channels to have that conversation with the decision makers, we sort of relied on our advocacy advisory group to figure out a way to make the findings known and to get that information to those decision makers. And so they came up with a really a concerted effort around the release of the report, which had some really interesting effects. So it ended up being picked up in 50 newspapers, both in Australia and then outside of Australia as well.
And it was front page on a few of the national newspapers in Australia, which is pretty unusual for HIAs and public health in general.
Yeah. So this one is from The Age, which so the title is Trans-Pacific Partnership, Written in Secret in the Interests of Corporations. So you can kind of see the slant that they're taking on what our findings were. But it was great because this has a really high readership. These are some of the largest publications in Australia. And then we had internationally, so this comes from a Latin American newspaper that's based out of New York, but publishes for readership in Venezuela and other parts of Latin America. So free trade agreement would increase costs of medicine in Mexico, Peru, Chile, and other countries. So some really interesting sort of, looking at this, even though our impacts were focused on Australia, sort of looking at sort of the broader implications of that within other countries. We had, I think it was like 35 radio interviews also related to our findings. And then we had, this was interesting. So this is ABC, which is sort of a large broadcaster here in Australia, did a lengthy news report around sort of both our findings, but then sort of some of the broader implications of the TPP. And in that process, they ended up interviewing Andrew Robb, who is the Minister for Trade. So even though we weren't sort of able to have that dialogue with him, it was sort of interesting to see this news reporter probing him on some of the issues that we had identified within the TPP. It also led to some interesting sort of political activation. So what I mean by this is that politicians got interested and were sort of able to use this evidence to support what some of the concerns that they had about this as well. And I'm going to play for you a clip from one of these sort of media interviews with a member of parliament, and hopefully the sound comes through on this.
Every time Andrew Robb fronts the media, he paints anyone who criticises his free trade deals, especially the Trans-Pacific Partnership Agreement, as being a small group of shameless fearmongers. Well, we've had the AMA, the Australian Medical Association, come out and express concerns about the potential impact on the PBS system. And today, we've got a group of 5 health experts from across the country, from a respected think tank, who've also painted a very grim picture about the risks of the Trans-Pacific Partnership Agreement. These aren't a small group of shameless fearmongers. These are some of the best experts in the country. And isn't it interesting that last week Andrew Robb was happy to leak a story about the potential benefits to the sugar industry from the Trans-Pacific Partnership Agreement, but he won't comment at all. He won't comment at all about his secret deal on medicines. So this is my message to Andrew Robb. A small spoonful of sugar is not going to make the medicine go down.
So then additionally, the HI was then directly used for some of the advocacy efforts. So after the report was released, there ended up being the Senate Foreign Affairs, Defense and Trade Committee had a meeting to discuss the trade making process. And some of our partners, so here you see Michael Moore from the Public Health Association of Australia, Deb Gleeson, one of the researchers involved on the report. And then in the background, we also see Pat Reynolds, who works for the Australian Fair Trade and Investment Network. They actually testified using some of the findings from the report within the Senate committee.
So in terms of some of our reflections about doing this HIA and the impacts that it had, we thought that this HIA sort of demonstrates the usefulness of using HIA to engage in potentially sort of contentious political decisions. Having this technical process and a technical document that can be used to engage, policymakers with. And we think there aren't that many examples around of using health impact assessment at this kind of higher level upstream policy. And so, we thought we've given it a go, and we developed some ways of adapting the typical HIA methodology to fit this kind of uncertainty of policy at that level. And so we're hoping that kind of it shows it's a good case study now demonstrating that. And for us, it was a really exciting process in terms of working with this coalition of advocacy groups and seeing what can happen with it. For example, like Deb Gleeson, who you saw in that previous photo, she's really active in this area of trade and health, publishes all over the show, is constantly, she goes to these, when they have these negotiating rounds, she flies out to Hawaii and tries to talk to the negotiators and stuff. And she was saying, like, she's never experienced this level of response to anything that she's done, as an academic or an advocate before. So somehow this HIA process of bringing, I guess, advocacy and this technical process together, had some really quite significant outcomes. And we hope that we've developed a model that can be used now for other, potentially other trade agreements, but also in other contexts. We were restricted in terms of, we focused on Australia. We would have loved to have done, a bigger HIA looking at impacts on different countries, but we just didn't have the resources to be able to do that. But we think that, by now we've got this model, other people could hopefully take it and adapt it and use it in their own context.
And one of the key recommendations we included in the report was that we said a health impact assessment should be conducted once the final text is actually released in public, so that because we had to do a lot of sort of inferring on this to figure out what we thought the final provisions would be, but it would be really great to be sort of more concrete in making those predictions based on that final text.
So that sort of wraps up the presentation. We'd just like to, thank the support that we got. We got support from our director at Chetra, who found pockets of money that we didn't know existed to get Katie on board, and the centre that we belong to at UNSW. The Public Health Association of Australia that hosted our workshop and supported us throughout, and all of our advocacy and technical partners that came along for the ride with us.
So what we'll do now is open it up for any questions you might have. We're happy to sort of have a discussion. I'm going to see if I can actually unmute.
Yeah, I think we can. Oh, congratulations on a very specific. Can't read it now.
Oh, sorry.
And thoughtful report and successful dissemination. I wonder if you considered analysing the likely impact of trade agreements on income inequality and the broader context of current trade policy, e.g. deregulation, privatisation and corporate advantage.
Well, so this is, I'll mention that, so there's a lot of conversation around, there's a lot of rhetoric around trade agreements and the fact and the ways that they can potentially sort of increase the economy and how that can be, good for jobs and how jobs are good for health. And which I understand is slightly different from what I think this is Ellen is asking. So we hadn't necessarily looked specifically at things like income inequality because we weren't necessarily looking at that pathway in terms of how trade agreements have an impact on the economy. And that was really because we sort of, we gave a lot of weight to our advocates in this area in terms of what scope we picked. So in the beginning, we wanted to look at things like potentially what the impacts could be in other countries. We had even talked about looking at some of the human rights impacts related to this. But when it came down to sort of picking those final pathways, we realized that the people that we were sort of partnering on this had real strong sort of advocacy areas that they were already working in. And so to be most useful to them would be to focus on sort of those pathways where they were already engaged.
Yeah. Okay, so from Donald, great report. However, did you consider calling for exclusion of tobacco and maybe alcohol from the TPP?
So yeah, we had so we talked about having these general public health exclusions, and there's some discussion about having like a carve out for things like tobacco or carve out for alcohol. But what we said is that if you only carve out some of these specific areas, then it sort of gives the negotiators room to say, well, we have protected health in this way without looking at all the other impacts and sort of some of the other ways. So that's why we, rather than having a focus just on carve outs for specific areas, we looked at having sort of including that broader public health exclusion from the provisions.
Okay, any comments on the proposed transatlantic trade agreement? That's another trade agreement that's crying out for a health impact assessment, we think, because it's a pretty similar trade agreement in terms of the main areas that they're trying to work on. And so, yeah, we've had a few chats to some people in the UK, but haven't really hasn't gone any further than that. But we would be really interested in getting involved or supporting any kind of HIA that could go on that side of the world as well.
And that is that's earlier in the negotiation process. So again, there's lots of potential to use an HIA to inform that process as well.
Yeah. Okay. David. I think David's in the UK, isn't he? This is an excellent tool to analyse and illustrate the potential impacts of trade policy on health. Have you approached some other governments participating in the TPP? I think it will be the smaller countries that can force public health exemptions. I work for the US Food and Drug Administration and help negotiate the TPP and the TTIP. Wow.
Yeah, so we were really interested in looking at the impacts to some of those smaller countries, like particularly countries like Vietnam. And just for the scope of this report, we weren't able to do that. We have actually started conversations with other organizations in the U.S. to look at potentially conducting an HIA on the effects within the U.S., but we haven't had the opportunity yet to sort of connect with any other sort of governments
Yeah.
or other sort of, I mean, we talked to some people in the UK, but we haven't
Yeah.
really talked to anyone else from some of those other countries. But it would be really interesting. It would be great to sort of, again, like we would love to see an HIA done within each country to sort of look at those country specific impacts, because they will vary so greatly depending upon what public health policies are already in place when the TPP is ratified.
Yeah, or it'd be interesting to do like sort of like an equity focused health impact assessment, looking at the equity impacts in terms of looking at different countries, like doing some comparative work would be great. Okay, got another comment from Donald. For your information, there is an HIA policy resolution that will be considered at the November annual meeting of the American Public Health Association that is consistent with your fine report. That's exciting.
Yeah.
Yeah.
That is great. Oh, and that, yeah, so just real
Thanks,
quick,
Jonathan.
from a little
Yeah.
note from one of our partners, so this is just to mention that that HIA that we are looking at doing to see how the TPP could have an effect in the US could really benefit from having funding to do that. And so if, we mentioned when we were doing this, we sort of just had to scramble and pull together some internal funding in order to do it. But it would be really great if we could have other partners, external partners in the US that would be able to chip in some funds in order to help pay for that. So, please feel free to contact me or Krisha if you know of anyone, or if your organization might be willing to put in some funding towards conducting that HIA.
Okay, David. Thanks. I'm interested in getting public health experts on the USTR trade committees. Right now, we don't even have a committee on trade and health, but there are committees on trade and the environment and trade and labour. That would be really interesting. It'd be really interesting to hear more from you, David, in terms of what would be the things that would be useful in terms of making that happen. I wonder if we can unmute you. Unmute. David, if you've got a microphone, you could maybe talk to us briefly.
Hi, this is David. Can you hear me?
Yes.
Great.
Great. So thank you very much for your presentation.
Thank you.
This is really a terrific tool and something that I'll be looking at using as I analyze trade and health issues.
And are you able to talk to us a little bit about your comment on the trade committees?
Yes. So what bothers me is that we already have this USTR committee on trade and environment and another one on trade and labor, but there's not one on trade and public health, which is absolutely needed. So I'm doing some advocacy work and writing a paper on the need to have public health experts involved in committees. Right now, we in the U.S. government and we in the Food and Drug Administration review the texts, but there's such a disconnect between public health experts and trading people that we can't easily get our point across. And we're constantly playing defense.
Yeah.
Yeah, that's absolutely an issue in that, what we saw going into this, there's been a lot of conversation about who's been invited to the negotiating table. So I've heard comments that, you see large corporations like Walmart who've been invited to actually look at specific sections of the TPP text to sort of have a comment on and to talk about what the impacts would be from the corporate standpoint. But there haven't been really any invitations to sort of the public health world, and even members of Congress and members of Parliament here in Australia are restricted in being able to look at that. So I believe in the US, they're not even allowed to bring like their senior policy advisors with them to look at the text. So, so I think that, when we talk about trade and when we talk about the health impacts, we can look at the specific outcomes from the specific trade agreements, but in a lot of ways, I think, which is what sort of David is getting to, there needs to be a bigger conversation about what the process is in general, about how these types of policies are made, how they're accountable to the public, and what are the regulations involved, and who has a say in what goes into them.
Yeah, I mean, our impression from the Australian context, at least, was it's like it seems like the context within which these conversations are happening are one where health just doesn't even kind of exist on the radar, and it's just that the dominant discussion is all about the benefits of trade and economic elements, and so it's at the moment it just feels like it's so far away from being a discussion that health can be involved in.
So a comment from Ellen, there is a long history of advocacy in the U.S. for public health involvement in trade committees. Mm-hmm. Yes, there absolutely is, and I didn't mean to imply that there isn't, that there isn't this conversation going on. I simply meant to imply that it'd be great to sort of continue to see that advocacy moving forward and incorporating public health into these trade agreements.
Yeah. Couple of final comments. We've got one from Donald. Are European partners looking at HIA in the TIPP? I haven't heard of any HIA specific activity happening yet. I've had a few conversations with a few people in the UK, but they've only got as far as like, wouldn't this be a good thing to do? So if there is actual HIA activity going on, we're not aware of it yet. And then Jonathan, one thing to be careful of, if health considerations are built into official government process, it will be hijacked. Good call.
Yeah.
Yeah. So I guess that's probably, means that we need to have lots of different types of activity going on. So that's one element of it, but at the same time we have to have our sort of advocacy efforts continuing and other more independent probably processes.
All right. So we'll end it there. We want to thank all of you for, I know it's late in the evening for you, those of you who are on the East Coast. So thank you all for joining us. As I mentioned, we'll be sending out the slides with our contact information. Happy to answer any additional questions that come out of this.
Yeah, feel free to contact us. We love talking about this stuff.
Okay, thanks everybody.